Hello, welcome to Alive to Thrive OT. I'm Lauren Lyman, and today I'm here with Dr. Sarah Hume. Dr. Sarah is a naturopathic doctor. She is a licensed acupuncturist, a craniosacral therapist, and an herbalist. So today we're going to talk to Dr. Sarah about how she can improve your health and your wellness. So thank you so much for joining us today. Can you tell us a little bit about your journey and what led you to who you are today and the services you offer?
Yeah, absolutely. And thank you so much for having me, Lauren. It's a real pleasure. I would say the journey that led me to where I am today started with when I was very young and being influenced by my family. So, my grandfather actually had a health food store when I was very young, and he would talk about lots of natural foods and herbs and vitamins to help with common ailments. And so that was a huge influence on my upbringing. And then my mom was a labor and delivery nurse as well. So that got me really interested in healthcare from a young age. And then growing up, it's kind of interesting because I didn't know that I was necessarily going to end up being a naturopathic doctor or practicing acupuncture. But my undergrad was actually in social work, where we looked at a lot of socioeconomic factors and the mental emotional playing a huge role in health. And so, some events that occurred to me during that time that really influenced me, one was there was a tsunami that occurred in India during that time. And that was really, it really hit home for me because I had done an internship, a social work internship in the south part of India not too long after that. And so for me, that was very, it made me want to kind of do something about that and either go into the healthcare and become a medical doctor or just do something that could help people in those situations. And then another thing that happened during that time was I started to develop a lot of mental emotional issues myself. I started developing anxiety and I had difficulty concentrating. And thanks to the help of nutrition and seeing working with natural providers, I was able to kind of address that and get that under control. And through that process, and afterwards, I also worked for a natural health company for many years. That kind of empowered me to make changes in my health and learn about other alternative forms of medicine. Of course, traveling had a huge impact on me as well, spending time in India and China. My own father is from Hong Kong, so also from the Asia continent. And so being exposed to different herbs that his family had growing up also had a big impact on me. And so, in short, it was through my own experiences, my own health challenges. I also had some digestive issues that were resolved with natural medicine over a long period of time that made things very personal for me and maybe really want to help other people with common ailments that we face in modern society that can be addressed with nutrition and herbs and just addressing the whole person, lifestyle, and addressing the mental emotional. And so that's really what got me interested in both acupuncture and naturopathic medicine, which is a naturopathic doctors, we are trained similarly to conventional doctors. We have similar training, but we're also taught to look at root causes of disease. So things such as the lifestyle, the diet, nutritional deficiencies, and also the mental emotional is taken into account too. And so it really is quite a comprehensive system. Same with traditional Chinese medicine too, of course.
Thank you for sharing your journey. Can you talk a little bit about craniosacral therapy? Because I think that's one that people aren't as familiar with.
Yeah, cranial sacral therapy, it kind of involves light touch and it addresses imbalances in the nervous system. So, by addressing with light touch, the fascia that surrounds both the cranium and the low back region of the body that can influence the structures that are there and address any kind of structural issues. And also it works on balancing the parasympathetic nervous system and the sympathetic nervous system. So the balance between resting and digesting and the fight or flight response, which is really common in today's modern society. It's very pleasant overall. Again, it doesn't involve any high velocity adjustments or anything. It's all very light touch and very subtle in its practice.
All right, thank you. So are there specific types of ailments that you see more often, or a certain client population that you see, or is it really just anyone who's looking for medical treatment?
Yeah, overall, I'd say a lot of people that have chronic conditions that are a little bit more complex and have multiple systems involved are usually come in for consultations. People with things such as digestive disorders, hormonal imbalances, autoimmune conditions, and some mental emotional as well. Those would be the most common things that people will come in for. And of course, just regular health and wellness, people who want to see how their blood work is and see if there are any nutritional deficiencies. That's another thing that people will tend to come in just out of curiosity, because we do quite a bit of functional nutrition testing in our practice as well.
Thank you. So what does a typical session look like with you? So if someone were to come in looking for an evaluation, what would that first session look like, and how do you know which modalities to use with that client?
Yeah, typically I'll offer a 15-minute free consultation for any new patient or client that is interested in the services. And typically we would decide based on their goals, whether, for example, a naturopathic consultation would be more appropriate as opposed to acupuncture or cranial sacral. A lot of patients will do a combination of services to address different aspects of their health. And naturopathic consultation is quite comprehensive, and we offer two different options there. One is a comprehensive evaluation in which we do a very thorough assessment of the medical history, as well as something that's known as a functional metabolic assessment that looks at the way that the different systems of the body are functioning together. For example, how's the digestive system interacting with the hormonal system, with the liver, the gallbladder, and to see how functionally everything is working together. And then a more problem-based naturopathic session would be more focused on a specific problem, specific symptoms versus looking at the whole person. So this might be somebody who is a little bit more on, they may not want to do a 90 to 120 minute initial consultation, which is usually for comprehensive naturopathic assessments. And then of course, follow-ups usually last anywhere between about 30 to 60 minutes, depending on, and of course, everything, it depends on how chronic or complex a person's situation is.
So obviously everything is very individualistic based on the person's needs, but after specific problems are addressed, are you the type of doctor someone would have as their primary care physician, or if there's a specific interest or need in a certain area of treatment?
I'm more of a health consultant. I do physical exams. However, I'm not licensed to be a primary care provider in the state of Illinois. So it's usually recommended to have that outside of our services.
All right, thank you. So if someone wants to get in touch with you, if someone's interested in your services, how can they reach you?
They can reach me at www.wholeheartednaturopathic.com. There is a description of the services there, as well as some blog posts on healthy living. Or they can email me at Dr. That's Dr. Sarah, Sarah, Hung, Hung, N as in Nancy, D as in doctor, @gmail.com.
All All right, great. Thank you. So I will actually post all of your information in the description of this video so that people can contact you. Is there anything else that you would like to add?
Well, just again, I'm very excited to be a part of this network of like-minded practitioners. I know we're all looking to find the underlying causes of illness, and we're all in this together. So thanks for having me on board.
Thank you so much. Thank you for the interview. Thank you for spreading your love and your light and knowledge throughout this world and for touching everyone's lives.
Thanks.